Welcome. In this video, we're diving into sciatic nerve dysfunction, often simply called sciatica. We'll explore what it is, what causes it, how it's diagnosed, and what you can do about it. If you've ever experienced shooting pain down your leg, you'll want to stick around. So, what causes sciatica? The most common culprit is a herniated disc in the lumbar spine. Think of your spinal discs like jelly donuts between your vertebrae. If the jelly pushes out, it can press on the sciatic nerve. Other causes include spinal stenosis, which is a narrowing of the spinal canal, bone spurs on the vertebrae, and less commonly, tumors or infections that compress the nerve. Even prolonged sitting, especially with poor posture, can contribute. Now let's talk pathophysiology, what's actually happening inside. The sciatic nerve, the longest and widest nerve in your body, originates in the lower back and runs down each leg, branching into smaller nerves that innervate the foot and toes. When something compresses or irritates the sciatic nerve roots in the lower back, it triggers an inflammatory response. This inflammation and compression disrupts the nerve's ability to transmit signals properly. The result: pain, numbness, tingling, and weakness along the nerve's pathway. Sciatica is a fairly common condition. It's estimated that up to 40% of people will experience sciatica at some point in their lives. It tends to affect people between the ages of 30 and 50, and certain factors like obesity, a sedentary lifestyle, and jobs that require repetitive twisting or heavy lifting can increase your risk. The hallmark symptom of sciatica is pain that radiates from the lower back down the buttock and the back of the leg. This pain can vary in intensity, from a mild ache to a sharp, burning sensation or excruciating pain. Other symptoms include numbness, tingling, or muscle weakness in the leg or foot. You might also experience a pins and needles sensation. Symptoms are often worse after prolonged sitting or standing, coughing, or sneezing. Sometimes, the pain is so severe that it makes it difficult to walk or even stand. Diagnosing sciatica usually involves a physical exam and a review of your medical history. During the physical exam, your doctor will assess your reflexes, muscle strength, and ability to feel sensations in your legs. A straight leg raise test, where you lie on your back and your doctor slowly raises your affected leg, is a common way to check for sciatic nerve irritation. If necessary, imaging tests like raise, MRI, or CT scans may be ordered to visualize the spine and identify any underlying causes, such as a herniated disc or spinal stenosis. Nerve conduction studies might be done to assess nerve function and identify the site of the nerve compression. While sciatica doesn't have distinct types, in the traditional sense, we can classify it based on duration and severity. Acute sciatica refers to symptoms that last for a few weeks, while chronic sciatica persists for more than 3 months. Severity can range from mild, where symptoms are manageable with self-care, to severe, where the pain significantly interferes with daily activities and requires medical intervention. Fortunately, most cases of sciatica resolve with conservative treatment. Initial management often includes rest, ice or heat packs, and over-the-counter pain relievers like ibuprofen or acetaminophen. Physical therapy plays a crucial role in strengthening the back and abdominal muscles, improving flexibility and correcting posture. Specific exercises and stretches can help to relieve pressure on the sciatic nerve. If pain persists, your doctor may prescribe stronger pain medications, muscle relaxants, or corticosteroids. In some cases, epidural steroid injections can be administered to reduce inflammation around the nerve. Surgery is usually reserved for cases where conservative treatment fails to provide relief, or if there is significant nerve compression causing severe weakness or loss of bowel or bladder control. Surgical options include discectomy, which involves removing part of a herniated disc, or laminectomy, which involves widening the spinal canal to relieve pressure on the nerve. While you can't always prevent sciatica, there are things you can do to reduce your risk. Maintaining good posture when sitting, standing, and lifting is key. Use proper lifting techniques by bending at your knees and keeping your back straight. Regular exercise, especially core strengthening exercises, can help to support your spine and prevent injuries. Maintaining a healthy weight can also reduce stress on your spine. And, of course, avoid prolonged sitting and take breaks to stretch and move around. The prognosis for sciatica is generally good. Most people experience significant improvement with conservative treatment within a few weeks or months. However, some people may experience recurrent episodes of sciatica. Recent research is focused on developing less invasive surgical techniques and identifying specific genetic factors that may predispose individuals to sciatica. Studies are also investigating the effectiveness of alternative therapies, such as acupuncture and chiropractic care, in managing sciatic pain. Further research is needed to fully understand the long-term effects of different treatment approaches and to develop more targeted and effective interventions.